I'm Tim Hyder, a Media Public Information Officer for the Oregon Health Authority. Welcome to our Facebook Live discussion. This is our forum for the public to ask questions and get answers directly from our experts. I'd ask any media on this forum you're welcome to listen in, but please reserve the questions for members of the public. With us today are Dr. Tom Jeanne, Deputy State Health Officer and a Senior Health Advisor for the Oregon Health Authority, and Colt Gill, Director of the Oregon Department of Education. They will answer your questions about COVID-19 in children and the protections that have been formalized in our schools to ensure that students in Oregon can safely return to in-person instruction. We welcome your questions, but ask that you please keep it to those topics. And with that, we'll go to Dr. Jeanne.
Thank you, Tim. So the pandemic in Oregon seems to have reached its peak. Daily infections and hospitalizations are slowly but steadily declining from the record highs we experienced in early September. But Oregon's hospital system is still near capacity. Over 900 beds are filled with COVID-19 patients, most of them unvaccinated. The Delta variant is an ongoing threat, and we want to make sure Oregon's children are protected as much as possible. Our pediatric reports give Oregon school and local health officials a closer look at how the virus is affecting our children. Pediatric COVID-19 case counts have increased dramatically since July 2021, but the current report shows that the number of new cases appears to be declining from the surge we experienced in August. As with many of our data sources, there is a lag time due to the time it takes for cases to be reported to us, but as of September 5th, cases for children overall declined slightly, while cases for kids ages 6 to 11 are slightly rising. As of September 16th, we are reporting pediatric and neonatal hospital capacity separately. It's important to track pediatric hospital capacity to identify the severity of COVID-19 spread among children. We can also use the information to address any capacity needs. This better reflects hospital capacity for pediatric patients with COVID-19 who need intensive care. That data shows statewide that Oregon has limited pediatric bed capacity. As of yesterday, there are 63 out of 337 pediatric beds available. Only 7 of intensive care unit beds are available, however, and 47 out of 47 total staffed ICU beds for children. The combination of limited hospital capacity and a return to in-person schooling requires a balanced approach to ensure the safety of students and staff. We can protect ourselves, our children, our schools, and our families by modeling the good habits that have been proven to work. And those are consistent use of masks, good hand and cough hygiene, physical distancing, vaccination for ages 12 and older, and staying home when you're sick. Our schools have added protections for students that include changes in ventilation, air filtration, and group size. Every element, no matter how small it seems, is important to help make sure our students have a safe in-person school year. Our evidence shows that implementing these steps does limit transmission in schools. One of the most important tools we have in our fight to contain the virus is the availability of COVID-19 testing for students and staff. Access to regular and reliable screening and testing can identify COVID-19 infections more quickly and help to slow the transmission in K-12 settings. What is the most effective tool to stop the spread? Vaccines. The available vaccines have proven to be safe and effective at preventing serious illness and death from COVID-19. And once the federal government approves vaccinations for children under age 12, we can work together to make sure our younger children get vaccinated too. Getting this age group vaccinated will be an extremely important step to control the spread and the impact of the virus. In the meantime, OHA has worked closely with the Oregon Department of Education to ensure that our schools remain well protected against COVID-19. And now Director Gill will discuss that the multi-layered approach in Oregon schools, students and families have adopted to support in-person learning this school year.
Great. Thank you, Dr. Jeanne. I'm happy to be here with you today. We're now several weeks into our third school year that has been impacted by COVID-19. For this school year, we set a goal as our North Star to safely and reliably hold school full-time in person every school day all year long. This is possible because schools are pretty controlled settings. They're a place where we are all used to following rules to help everyone get along with one another and to help keep everyone safe together in that space. No one protection measure is enough when many people are together in a space for long periods of time, as happens in schools. But schools can layer multiple safety protocols like face coverings, vaccinations, physical distancing, use of cohorts, symptom screening, hand washing, and added ventilation that helps create protection for everyone in that setting. Taking these steps to hold school in person is important. Nearly all of our children learn better when they're taught in person by talented teachers who build strong, caring bonds that lead to each child growing and learning beyond our expectations. Our kids also need social interaction. They made that clear over the last school year. They need time with their friends and peers, and this creates well-being and instills happiness in them. Many of our kids need to access a solid breakfast and a warm lunch that's also offered at school, and many can benefit from the physical and mental health services that are available in many of our schools. Our schools are places of learning and care, and our kids need to access them again. The key to making this happen is taking every step possible to avoid spreading COVID-19 in our schools. Layered protocols not only prevent students from getting COVID-19 and possibly spreading it to others in their household, but it also keeps our children in school. When students become a close contact to someone with COVID-19, they must quarantine to avoid the possibility of further spread. Quarantining, though, also removes students from school and impacts learning, and it is one of the greatest challenges that we're facing this school year. There are steps we can take that both reduce spread of COVID-19 and reduce the number of students who are in quarantine. When eligible students and adults vaccinate, they don't quarantine unless they're symptomatic. So vaccinated students and staff don't need to quarantine when they're a close contact. That helps keep everyone in school. When people wear masks, face coverings, they're less likely to be quarantined. The rules are a little bit different when you're a close contact, close to someone with COVID-19 with a mask on, and when they have a mask on versus when they aren't. And when schools use physical distancing and cohort protocols, these are things like having seating charts in schools, marking spaces in hallways where students should stand and where they shouldn't stand, using superhero arms when they're walking in line to stay physically distanced from one another, closely managing transitions, and keeping contact logs for who students are in contact with. Those are the kinds of things that prevent our students from getting quarantined as well, because they help maintain physical distancing and they help the school know who each student was in a close contact with. This is the difference between a whole bus or a whole classroom versus 2 or 3 students being quarantined due to a single person coming into a school setting with COVID-19. The better we adhere to health and safety protocols in schools, the less likely we are to be quarantined, the less likely we are to get COVID-19 and spread it to others, and the more likely we are to stay in school. All of the other layered protocols a school implement also reduces the likelihood of COVID-19 spreading in that space, making it a safer space and one where fewer students are quarantined. These include those that I've already mentioned: vaccination, face covering, physical distancing, cohorting, but also improving airflow and circulation with outside air, improving that ventilation, increasing the amount of hand washing that's available, cleaning and disinfecting surfaces, symptom screening throughout the day. So having staff and students watch themselves for symptoms and make sure that they report those so that we catch COVID-19 very quickly in the school setting. And like Dr. Jeanne pointed out, regular COVID-19 testing in schools. These are not all convenient protocols to implement. They are a real challenge, but they pay off is stability. It allows our kids to be in school with their friends, learning, growing, and playing. That's our goal every day for all of our students. think with that, Tim, we can begin to answer questions.
Thank you, Dr. Jeanne and Director Gill. Our first question is from Natasha. How are schools safe and not COVID super spreaders every day?
Great. I think I can start with that one and note that there is a big difference between schools and what we think of as super spreader events. The one thing that is the same is that there are a lot of people in the same setting. What's different between a super spreader event and a school is that a school is a controlled environment where we have many layered protocols in place. We have required face coverings across the state of Oregon. We have physical distancing. We have tracking where students are at and who they're in contact with. We have airflow and ventilation support. We have adults in the system vaccinated. And right now, about 60% of our eligible students are vaccinated in the state of Oregon. All of those things help us control the spread of COVID-19 and are really working to help prevent the spread of COVID-19 from one person to another in the school setting. What we also need, though, is for families to be very cautious around schools. So if you're part of extracurricular activities like sports and music and other events that happen before or after school, try to follow as many protocols as you possibly can. Those are places where we are still seeing spread of COVID-19. Dr. Jeanne, I don't know if you have more to add to that.
Yeah, I just think this question really does highlight why we're doing all these things, because before the pandemic, we certainly did see things like colds and flu spreading to school to some extent. But now we have so many layers in place that we didn't back then. And that's exactly the answer to why we are not seeing in major in-school transmission.
Thank you. Our next question is from Scott. Why aren't schools remote until children under the age of 12 can get vaccinated?
So I can take that first if it's helpful. Tim, thanks for the question. Scott, thanks for sending that question in. We do, as soon as students under 12 are eligible for the vaccine, it's really important that they participate in that. One of the great benefits of the vaccine, beyond reducing your chances of getting COVID-19 significantly, and then if you are a breakthrough case, greatly reducing the severity of the COVID-19 case that you get, is that it prevents you from being quarantined unless you are symptomatic. So the vaccines are a really helpful tool, but we also, as we shared in our statements earlier, we have about 8 other layers of mitigation that we think are really helpful to ensure that our students aren't spreading COVID-19 in the school setting. And we think it's just critically important to get our children back to school. You know, school is a place not only where they're learning, but where they're interacting with friends, where they develop a close relationship with an adult who's outside their family. And it's where learning really takes place. We think that the learning that happened online last year was a real challenge for a lot of our students and a lot of our families. And school offers the opportunity for things to get a little bit closer to normal.
Yeah, and I would just add that, you know, what's different this year from last school year is we have more kids in school in person, and we also have the Delta variant. And the Delta variant is about twice as transmissible as previous variants that we had circulating last year. But we know that it's still essentially the same virus. It's transmitted the same way, and things like face coverings, physical distancing, and of course, vaccination really do work against it. We reviewed a lot of evidence last spring from around the world, both scientific studies and reports from schools. Really, the conclusion was there's not a lot of in-school transmission when those measures are in place. And so that's why we have decided that the benefits definitely outweigh the risks of having schools in person, even though not all children are yet eligible for vaccination. And we do hope that vaccination will be authorized for children ages 5 to 11 sometime this fall.
Thank you. A question from Michelle. When and where are school outbreaks reported?
I can take that one. So school outbreaks and school cases in general are reported by OHA every week. There's a weekly update. It's called our weekly outbreak report, and that's on our website. We'll give the link at the end, or I can give it right now. It's healthoregon.org/coronavirus. And that report lists every school in the state that has had a case reported, at least one case in a staff or student. And starting this week, we'll be reporting those schools with true outbreaks. In other words, schools where there was evidence of in-person transmission. Because a school could have 2 or 3 or 4 cases, but that doesn't really count as an outbreak if those cases were brought in from households from the community. So that's where we're changing our reporting, and that's all going to be available again every week on our website. And then Director Gill, if you wanted to address how school outbreaks are reported within or by schools or to parents.
Happy to. Thanks, Dr. Jeanne. So we have a guidance document called COVID-19 Scenarios in Schools that is sent to all of our school districts in each of our schools and charter schools and private schools around the state. And it gives them a step-by-step approach to every time they have a COVID-19 outbreak in a number of different scenarios, whether that's from a staff person or a student, and how they find out about it. But in that document, what's really critical is that there's a communication toolkit where we advise every school to use templates that we've created to make sure that they're keeping their families and the rest of the staff in the school informed if they have a case in their school and what steps they're taking to ensure that that doesn't spread to others within the school environment.
Thank you. This next question is one we've gotten from several people. Janica is asking this one. Why isn't Oregon offering a test to stay program?
Well, thanks for the question, Janica. This question has been a big one we've been getting a lot lately. There's been a lot of media coverage of these so-called test to stay programs. Now, let me quickly explain what that is for people who may not be familiar. Basically, it means if you are exposed, there are some schools around the country where a close contact case in a school, rather than having to quarantine everybody who was in that classroom or everybody who had contact, they can test those people as long as they don't have symptoms. And as long as they're negative, and they get tested multiple days, as long as they're negative, they can keep coming to school. And it's been talked about as a way to prevent having so many kids staying home and quarantining, which is certainly a good thing. Unfortunately, it does require a lot of tests and a lot of additional burden on both schools and local public health. Right now in Oregon, we simply don't have enough of those rapid antigen tests that we're using for school testing to support a test to stay program. We are getting more shipments from the federal government and the test suppliers. So we'll reevaluate that. But right now, unfortunately, we just do not have the tests to allow tests to stay. But thank you for the question, and it's something that we will certainly consider going forward. Thanks.
Thank you. Our next question is from Marinelle. Please tell us about the new guidelines that went into place on September 14th, which changed the rules of who has to be notified and quarantined in cases of school outbreaks.
Tim,
Go ahead.
Tim, could you repeat I missed the first part of that question. I'm sorry.
Of course. Please tell us about the new guidelines that went into place on September 14th, which changed the rules of who has to be notified and quarantined in cases of school outbreaks.
Well, I know that for our quarantine for schools, we have basically a different standard based on the CDC's updated recommendations. And so it's only in an in-school, in-classroom setting that we have this rule. And that is when students are consistently wearing masks, they only need to be, and they're at least 3 feet apart as opposed to 6 feet in other settings. We don't consider that exposure. And that's based on evidence. It's based on these national guidelines, and also the recognition that 6 feet distancing is very hard in many schools. So for students only, it does not apply to staff or teachers or anybody else. For students only, if they're at least 3 feet apart and they're wearing masks, they would not have to quarantine if there was a case in that classroom. And Director Gill, I don't know if you have anything to add to that.
No, I don't think so, but I do think that has been the case all school year this year. So it could be that locally that was something that was just picked up on by some school or local area.
Thank you. Our next question is from Mariah. I hope I'm pronouncing your name correctly. Why aren't kids and teachers being tested?
That's a great question. I can start if you want, Dr. Jeanne. So in Oregon, the Oregon Health Authority, working with federal resources, has provided 3 testing programs for schools. And all of them we recommend that schools use every one of them. And they have a couple of different purposes. So the first one is a test that is used as a diagnostic test. So when a student or staff member has symptoms of COVID-19 or has been a close contact with someone with COVID-19, then they can take a quick test on site to help determine whether they have picked up the disease or not. And then there are 2 screening test programs. So there is one for staff. The staff test is done in the privacy of the staff member's home, and they can maintain the confidentiality with the testing facility and the local public health authority if they were ever a positive test. And those are available to educators on a weekly basis if they sign up for that program. And that's available to all Oregon educators, everybody who works in a school who is unvaccinated. And then the final one is for students. So there is student screening testing available. We're still building up the resources to be able to do this for as many students as we may like to eventually in the state of Oregon, but it is happening in schools across the state. The Oregon Health Authority has developed strong partnerships with regional labs in each part of the state who are connecting with schools. And some of that screening testing is done at the school site, and some is offered in the students' homes as well. I guess I'll stop there, and Dr. Jeanne, if you have more to add, or if I got any of that wrong, please correct.
No, nothing to add.
Thank you. Amy has the next question. What is the vaccine rollout plan for kids age 5 through 11 when it is approved?
Yeah, so that's something that we've been working on. You know, the 5 to 11 age group is a significant age group, but we also have, you know, nationwide, we've got a pretty good stockpile of vaccines at this point, just due to declining demand for the general population for whom vaccines are approved. So I think the rollout details, I can't give you any details right now, but I think the plan is going to be a pretty general statewide rollout. We're going to have to really make sure, again, as we have in the past, that we have taken equity into consideration, and that kids in different types of communities throughout the state really have as equal access as possible. There may be limited, you know, it may not be possible for all kids in this age group to get vaccinated right away in the first week or so, but we'll try to make sure that it's equitably distributed. Everywhere around the state has the opportunity as soon as possible. And I think it's also going to depend on just what our allocations are from the federal suppliers, the national suppliers. And so more details forthcoming.
Thank you. And we have another testing question, this one from Valerie. Can you tell us more about the take-home COVID-19 tests that you're going to start offering? Are they nasal tests or saliva tests? What is the turnaround time in terms of getting these test results? And when should the students get tested?
I don't have a lot of information on those. I believe there are both nasal and saliva test options. And that's one of the nice things about these tests. They also tend to be pretty rapid to get results. I don't know the exact turnaround time, unfortunately, unless you do, Director Gill.
No, I don't. Sorry.
Okay, next question is from Tina. What direction are you giving to school districts in regards to providing at-home education to students in quarantine?
Yeah, Tina, that is a really good question. And it's another one of our great challenges. I named earlier when I spoke that quarantining altogether is one of the great challenges we face this year. So I would say the first step is to reduce the number of students who end up getting quarantined. So taking this layered approach that we're talking about in every school district is critically important to reduce the number of students who get caught up in a quarantine. So that means using things like seating charts and making sure that you're marking hallways and that students know that to stay 3 feet apart from each other or 6 feet apart from each other in certain circumstances. is really helpful to reduce the number of students who end up getting quarantined and don't have access to regular school. From that point forward, the department does have recommendations around maintaining educational supports for the students, and even has pathways for the school district to be able to count the student as present during that time when those supports are provided. From there, though, Oregon is what is called a local control state. So all the decisions and efforts around this are really determined by each local school district and their board. So what is happening across the state is really 3 different models for the most part. So there's one model that some school districts are doing where they simulcast what is happening in the classroom at home to the student who's in quarantine. This is not ideal because the student isn't actually there participating in person or able to easily participate in group work, but they do hear and see everything that's happening in the classroom, and they can be a part of the instruction that's going on. That's one of probably the better ways that we have to offer support to students who are in quarantine for several days. Another one is that students who go to a school district where they're offering an online program, some of those online programs work in a way that a student who's on quarantine for a week or a week and a half or 2 can then move into that online program. That is really challenging, I'm going to say, both for the programs and for the student and family. Because the programs are not there teaching a group of students who are consistently learning from home. And so they may not be in the same place in the curriculum that the classroom students are. And the curriculum might even look different in those 2 programs. So it's not ideal. It is a way to ensure that the student is engaged in learning every day, but it might not be completely in sync with what the classroom learning was. And the final way that's happening is much like families have experienced and students have experienced when they do have the flu or some other illness where they're out for a period of time, where the teacher is making connections, possibly providing some instruction off hours, and then having packets of information for the students to try to maintain their learning. It is not ideal, and it is really why we need to do everything we can to reduce the number of students in quarantine.
Thank you. Question from Liz. If the under 12 age group are eating together indoors for lunch, how is it safe?
Yeah, I can tackle that one first. Liz, I think you've highlighted one of the challenges, and that is that kids need to eat. Kids need to take their masks off to eat. And when masks are off, there is a higher risk of transmission. So the first thing is, I think where it's possible and where the weather facilitates, eating outdoors is a great way to lower that risk. But if you are going to be eating indoors, there are again multiple layers that we can do without masking to make that as safe as possible. So that would include 6-foot distancing, making sure that kids are kind of sitting with their classroom cohorts and not mixing around as much. And then also lunch is a relatively short period, so it's not a long exposure compared to the rest of the school day. And then just ensuring that there's good ventilation in the room, and then there's some supervision so that students are not, running around and getting too close to others. Director Gill, anything to add?
No, I think you covered it. Thank you.
Thank you. Now we only have a few more minutes. Question from Lisa. What is being done about the delay in notifying parents about exposure?
So I'll start this one. I do think the first step to this, if you believe that's happening at your school or community, is to contact the school leadership or the district leadership. I will say that schools, sometimes community news spreads quickly and sometimes it's not all that accurate. And so schools are going to work closely with the local public health authority to really determine if there was a COVID-19 report and it was substantiated and it was at a school, and then they're going to go through their contact tracing to make sure that they are quarantining individuals who are actually close contacts. They'll make those connections. And they'll do typically a report to all families and all staff to report what happened and the steps that were taken to protect everyone. If you believe that that's not happening, it could be that it's a rumor and that there wasn't actually a case in the school, or it could be that they're running down all the details before they get that information out to everyone so that it is accurate. But I think the best source of information is to go directly to the school and ask the question.
Thank you. Final question today, excuse me, is from Drea. Why is testing only being provided to K-12 schools and not to preschools?
Well, I can start with that one. So a lot of the K-12, the reason we have it focused on K-12 is, I think, partly due to funding and availability of testing and the programs we put in place, kind of focusing on that as one of the higher risk groups. Now, preschoolers, even without a specific testing program, are certainly encouraged to get testing through their healthcare provider or any pharmacy or anywhere else that testing is available if they have a concern for exposure or they have symptoms. But it's not something that we've had capacity to develop a separate testing program for right now.
I think that's all accurate. And the one thing or two things I would add to that, I guess, is that Dr. Jeanne is correct. So the funding resources that have come in through the federal government are also aimed at keeping K-12 instruction operating this school year for families. And to add to that, in Oregon in particular, K-12 education is compulsory. So all students are required to attend school. Preschool attendance is not compulsory. It is a family choice and a family decision. So I think that the federal resources have come in to protect that opportunity to the greatest degree we can, so that we're implementing all of these protocols to help keep our kids in school safely. And as we get more resources, we'll definitely want to support our early learners as well.
Thank you very much. That's all the time we have today. I want to thank our guests today, Dr. Jeanne and Director Gill, for leading this robust discussion. We invite you to follow us on Facebook and Twitter, and to sign up for the OHA newsletter at healthoregon.org/coronavirus. Thanks to everyone for participating. Have a great day and stay safe.